you know, you got to love yourself before you can do anything effectively, right? Is that the number one thing when you have a patient come in who is obese off the bat? What is the most consistent issue you've seen that's non-medical?
Yeah, so no doubt about that. With people that I deal with, we're talking about people who have 100 pounds overweight. Those patients are all going to have some issue, whether it be social, psychological, emotional, even economic issues, getting a job, being promoted. They can be impacted because of the fact that their obesity is impacting their life. So I see a lot of depression, I see a lot of anxiety, I see a lot of panic attacks, we see social issues, marriages, friendships, things like that. So yes, all of those patients have to be dealt with their social and psychological issues.
Well, we did a pretty lengthy list of conditions that you can deal with if you are obese. Break it down for kids versus adults, because you see people who are dealing with the weight issue their whole life, but then is it true that the medical conditions don't kick in until they're older, or what are we looking at?
No, we can see kids, especially with the kids and the adolescents that we deal with. We deal with, you know, we call kids 14 years and above, and we can see diabetes and high blood pressure in those kids as well, just related to obesity, not the childhood diabetes that we see in young 6-year-olds, but obese-related diabetes. So there's no doubt that an adolescent with obesity can have medical conditions. There's no doubt that an adolescent with obesity can have psychological or social issues. We know very well the school yard is a very difficult place for those youngsters, and bullying and discrimination. So yeah, we see it. Now, as you get older, it gets worse because the medical conditions pile on and the medical issues get worse, and the severity, we're talking about heart attacks at the age of 40 and 50 years old.